Good evening. Thank you, Diane, for that nice introduction. We broke it up into two parts. I was going to talk a little bit about the question, why do you hurt so much when you have lupus, and try and maybe explain a little bit. And then Dr. Nowak is going to talk to you from the physical therapy, occupational therapy point of view. What's the purpose of why do doctors send patients to physical therapy? I would say that one of the things I remember in training that I had learned was, what separates the internist from the rheumatologist. And I trained a long time ago. We didn't have a lot of the medications that we have today. And one of my mentors said, the big thing is we send people to physical therapy. It really does work for the right patient, and great results. So let's move on. First slide. So these are common complaints in lupus, and you probably all either recognize them or the words you might not recognize. So we're going to go through them, but I'm sure most people have had many of these symptoms. You see arthralgia and you see arthritis. And for the rheumatologist, that's a big difference. The itis after the word implies inflammation. And what do we mean by inflammation? Well, it's really swelling. So a swollen joint, a red joint, a hot joint, a joint that's painful when you put it through a range of motion. That's usually a sign that there's inflammation. Whereas an arthralgia is where a patient will say the joint hurts. And the doctor might not find anything when he looks at it. It might look perfectly normal. And that can be quite frustrating, because if the doctor is not in touch, with, well, this is lupus, or there are many conditions that present with arthralgias and not arthritis, you have to have it in the back of your head that this really does exist. So arthralgias are very common. And actually, it's probably the most common manifestation of lupus. It's why, I guess, one of the reasons why lupus fell into the rheumatology ballpark in the very, very beginning, because many of these patients complain of joint pains as an initial manifestation. And then you see here myalgias and myositis. So myalgias, if you've ever had the flu, you went to bed, you were fine, you woke up the next morning and everything hurts. Well, a lot of times it's really a combination of arthralgias and myalgias. It just means that there's pain in the muscle. There may be no signs of inflammation. When we say myositis, we're talking about an inflammatory component. And lupus can do all of that. Sometimes with the myositis, you can see some features in the blood, and we'll talk about that. Tendinitis. Lupus patients can have problems not only with the joints, but other structures that traverse the joint, such as tendons. Tendons are basically to make a joint work, to make your arm bend. The structure that attaches the muscle to the bone is a tendon, very simply. And you can have inflammation here. Fibromyalgia, you may have heard of that condition. It can exist as itself as a primary illness without any other connective tissue disease. But we know that many patients who have connective tissue diseases also have a predilection for developing fibromyalgia. And these two conditions can coexist. And finally, I threw in thyroid disease, because many patients, when you have one autoimmune problem, it's not unusual sometimes to have another autoimmune problem. And thyroid disease, one, is very, very common, and very common in the kinds of patients that have lupus. And what I mean by that is in women. As you well know, as just looking out in the audience, the female-to-male ratio in lupus could be almost 9-10 to 1. But in thyroid disease, there's also a very, very strong female preponderance. So it's not unusual to have thyroid disease along with an autoimmune disease like lupus, and that can also add to the problem.